Good morning class. Today we will be dealing with an introduction to fixed dental prosthesis. So before we move on to the core chapters that come under this unit, we thought it would be best to give you guys just a broad view about this topic. So a lot of the time in your future clinical practices, you will come across patients who have lost a couple of their teeth. Okay, it could be because of any number of causes. It could be because of dental caries, it could be because of any periodontal issues that the patient may have, it could be because of trauma, it could be a combination of all of these reasons. Okay, so when the patient comes to you with loss of a tooth, okay, that can have a lot of impacts on that patient. Okay, some of which are the aesthetic factor. There could be issues in mastication. Okay, there could be issues where the loss of that tooth is causing harm to the adjacent teeth, okay, because of supraeruption or drifting or tipping. Okay, so the question arises, what can you do in these kind of situations? So one of the treatment modality options that you have are to provide the patient with a fixed dental prosthesis. Okay, so as the name suggests, it is a fixed prosthesis. So it is something that is going to be cemented or luted or fixed or screwed into the patient's mouth in such a way that the patient themselves will not be able to remove this prosthesis. Okay. So you can see these are the various examples of a fixed dental prosthesis. Okay, so generally you will notice that the fixed prosthesis is resting on 2 or more teeth, isn't it? 2 or more natural teeth, and these teeth are reduced in size. Okay, so we call that as a tooth preparation. So the teeth are prepared to receive the fixed dental prosthesis. So what is the branch of fixed dental prosthesis? How can you describe it? So it is the branch of prosthodontics that is concerned with the replacement or restoration of teeth by artificial substitutes that cannot be removed from the mouth by the patient. What is a fixed prosthesis? It is any dental prosthesis that is luted, screwed or mechanically attached or otherwise securely retained to natural teeth, teeth roots or dental implants or dental abutments that furnish the primary support for the dental prosthesis and restoring teeth in a partially edentulous arch, and it cannot be removed by the patient. Alright. Now, what are the basic parts of an RPD? So, this differs depending on the type of prosthesis that will be provided, but however, from a basic point of view, you need to know what are the parts of an RPD. Okay. So, we have the abutment. Okay, the abutment is the natural tooth or the tooth root or the implant, okay, or whatever is the main structure that is going to give you the primary support or the mechanical advantage. Okay. Then you have the retainer. Okay, so the retainer is the part of the FPD that will be resting on the abutment. Okay. Then you have the pontic. So the pontic is actually that part of the FPD which exclusively replaces the edentulous area. And finally you have the connector which connects the retainer and the pontic. Fixed prosthodontics includes the following types of modalities. So you have inlays, onlays, crowns, veneers and fixed partial dentures, to name a few. Okay. So what is an inlay? An inlay is a fixed intracoronal restoration, meaning it is within the boundaries of the crown. It is a dental restoration that is made outside of a tooth, meaning it is processed in a laboratory to correspond to the form of the prepared cavity which it is then luted into. Okay, so you have a preparation that you will do inside the tooth. Okay, you will make an impression, you will send it to your laboratory, your dental laboratory, and they will fabricate a inlay prosthesis for you which you will then lute or cement, okay, into that prepared cavity. Now, what is an onlay? An onlay is a partial coverage restoration that restores one or more cusps and adjoining occlusal surfaces or the entire occlusal surface and is retained by mechanical or adhesive means. Okay, so an onlay is going to extend onto the cusps. Okay. And finally, you have a crown. So, a crown is an artificial replacement that restores the missing tooth structure by surrounding all of or part of the remaining structure with a material such as cast metal alloy, metal ceramics, purely ceramics, acrylic resins, or a combination of these materials. So, you can see a comparison between inlays, onlays and crowns. Okay. So, inlays will be within the cusp margins, onlays will be involving one or more cusps, okay, and crowns will be covering the entire or almost the entire surface of the tooth. Now, coming to veneers or laminates, these are wafer thin custom made shells of tooth colored materials that are designed to cover the front surface of the teeth for aesthetics. So, veneers are a purely aesthetic or a purely cosmetic treatment modality. So, the patient will come to you saying that they want to change their smile. Okay, they may have gaps, or they may have discoloration, or they may have uh, non-ideal shape of the teeth, okay, something which is bothering their aesthetic sensibilities. They will come to you and ask you to change their smile. Okay, so in that case, what you can offer to do is a veneer. And then you have the fixed dental prosthesis. So these are again very commonly routinely practiced in most dental clinics. So here there is a missing tooth or multiple teeth are missing, and you will use the support of the adjacent teeth adjacent to the edentulous area. Okay, you will prepare those teeth, okay, and then you will cement the prosthesis in place. Okay. Now, based on the types of materials used, there are different kinds of fixed prosthesis. You have purely metal crowns, okay, which are made of either gold or nickel chromium or titanium or cobalt chromium. Okay. You have non-metal crowns, which could be either acrylic resin based or it could be ceramic based. Okay. And you have a combination of these. So, it could either be a metal and a ceramic fusion. Okay, so you can see in this picture here, there is metal on the inner surface of the crown, and on the outer surface you have a ceramic coating. Okay, so these are some of the materials that are used for a fixed prosthesis. Now, what is the need for a fixed dental prosthesis? So, first and foremost, to restore any grossly damaged tooth, any fractured tooth, or a tooth with a heavy amalgam or a composite filling. To restore the masticatory function as well as the speech, to restore the aesthetics, to maintain the periodontal health by recontouring the occlusion to prevent food impaction, to alter the occlusion, okay, as part of occlusal reconstruction to solve any such problems that the patient may have, and as a retainer for the bridge. So, these are some of the basic reasons why you would give a fixed prosthesis for the patient. Now, what are the disadvantages of this treatment modality? Not just crowns, this treatment modality. So, first of all, heat generation. So, if you use a burr that is not new, okay, or if you use too much of force while trying to prepare the teeth, or if you use too less of coolant, that is water, while you are preparing the teeth, there can be heat generation because of friction. Okay, so this can harm the tooth, especially the pulpal tissues. Over preparation. So, if you reduce too much of the tooth structure, okay, you end up with a really over prepared tooth. So, the problems that this causes are there will be loss of strength of the tooth structure. So, the tooth is more susceptible to fracture, breakage, okay, and also you may risk exposing the pulp of the teeth if you go too deep. And periodontal problems. So, if the margins of your restoration are not well formed, okay, and well adapted to the underlying tooth structure, there may be secondary caries, there may be food impaction and resulting periodontal issues. Now, coming to the general steps in the construction of cast restoration. So, based on the type of material that is going to be used for your prosthesis, the steps may vary here and there, okay, but this is just a general overview of the steps, just to give you guys an idea and an orientation as to how much effort goes into the construction of a fixed prosthesis.
So why is it important to know this? Okay. So first of all, to understand this branch of prosthodontics, that is fixed prosthodontics, and to have an idea or an orientation as we, delve deeper into this topic in the coming classes. Okay, that's the first reason. And secondly, if you think from a practical point of view, that is in future, when you become dental practitioners, and you have your own private practice, so you will be dealing with a lot of these kind of cases. Patients will come to you and will request for fixed prosthesis, or you all will discuss the various treatment plans, and then you will end up in deciding to go for a fixed prosthesis. So in such situations, as a practitioner, it is not enough that you know just the clinical aspect of fixed prosthodontics. Okay, it is very important to also know the laboratory procedures. Okay, and the various steps and the work that goes into fabricating a fixed prosthesis. Okay, so again, you would be wondering why, right? Because this will give you a better idea as to how to plan your treatment. Okay, and also what to keep in mind while communicating with your dental laboratory. Okay, knowing that the information that you give, whether it is by way of your prepared casts, your shade selection, the type of material that you require, okay, all those things. Okay, there are many factors. We'll again deal with that in the later classes, but you will have an idea what you have to give to the laboratory technician in order to get the best result from them. Okay, and therefore give the best possible clinical outcome for your patient. Okay.
So initially you're going to prepare the tooth inside the patient's mouth. Okay, so this example that I've taken is of a single tooth. Okay, so if you're giving a crown on a single tooth, alright. So you've prepared the tooth, you've made the impressions, you've poured the cast, and you have sent that cast to the dental laboratory. So what they do is they will first create a wax pattern, okay, which is a finished prosthesis that is made in wax. Okay, so this wax pattern is going to have all the characteristics that you want in your final crown. Okay, so that will be made in wax. This wax pattern is then invested. Okay, so when I talk about investing, what I mean is you will place a ring, a metal ring around this wax pattern, okay, and then you will pour an investment material, okay, into that ring, okay, and you will wait for it to set. Okay, so this process will take around 45 minutes to an hour or so, okay, for it to set. Once the investment has completely set, then you will take the investment along with this white apparatus here that you can see, which is known as a crucible. Okay, so you will take both of these things and you will place it inside a machine known as the burnout machine. Okay, so this machine, as you can see, goes to really high temperatures, okay, and its purpose is to, one, heat the crucible, and mainly it is to eliminate and burn out all of the wax. Okay, so this wax pattern will be completely burnt out, okay, and it will leave behind only a hollow space, okay, within this investment. Okay, once the burnout procedure is completed, then both the crucible as well as the invested ring is going to be placed inside the casting machine. Okay, and into the crucible will go the metal pellets. Okay, because we are talking about a metal restoration, into the crucible we will place the metal pellets. Okay, you will then close the casting machine. Okay, you will increase the temperature and you will wait for the metal pellets to become molten. Okay, so once the metal pellets fuse and become a molten mass, then you will release the lever of the casting machine. This lever here, you will release it, and then with centrifugal force, okay, the molten metal will flow from the crucible into the investment, okay, and that hollow space that was previously occupied by the wax pattern will now be occupied by the molten metal. Alright. When the casting procedure is finished, you will then remove the investment from the casting machine and you will wait for the metal to cool down and solidify. Once the metal has cooled down, then you will break off the investment and you will be able to retrieve your metal restoration. Okay, that will then be subjected to further finishing and polishing procedures and all that, but this is the basic idea of how a restoration is casted. All right. So with that we are done with the introduction. Okay, so we will deal with different aspects of this lecture in detail in the further chapters, okay, in the further classes to come. All right. So now we will have a doubt clearing session followed by a couple of activities based on today's chapter. Thank you.